if it's overnight. Well, it seems like the older we get, the more aches and pains we experience. So how do you know if it's an injury or arthritis that's causing that pain in your knees? Here to talk about it is Dr. Covey, a board-certified orthopedic surgeon with the Connecticut Orthopaedic Institute. Hello, doctor.
Hi, how are you? Thanks for having me.
Thanks for being with us. Now, how is arthritis of the knee diagnosed, and what are some of the symptoms that folks should watch out for?
Sure. Well, arthritis of the knee is typically diagnosed with an X-ray. That can be obtained either with your primary doctor or with an orthopedic surgeon such as myself. Symptoms typically start out intermittently and usually with little to no trauma. People who suffer from knee arthritis often note limited range of motion, swelling, weakness, generalized pain. Sometimes a sense of grinding can be present in the knee, and oftentimes a diminished endurance for activities that they tend to have done routinely prior to the onset of the arthritis.
And what can you tell us about some of the treatments for knee arthritis?
Sure. Well, treatment largely depends on the individual and their symptoms and what their goals are. For many, activity modifications, such as shifting away from vigorous activity more towards low-impact activities such as bike, elliptical, swimming, can help prevent these flare-ups. Taking a non-steroidal anti-inflammatory medication either before participation or routinely during these flare-ups can help. Other things that can be done, such as weight loss, use of a knee brace, some core strengthening or stretching that can be done under the guidance of a physical therapist, have been shown to be effective. And if these non-invasive treatment fail, then the next stop is potentially an injection into the knee. There are a couple on the market. One would be a steroid injection that a lot of people have heard about, and the second class would be viscosupplementation, or what some people know as gel shots. And then if everything else fails, as arthritis tends to be progressive, some patients with severe arthritis can be offered joint replacement.
And is there anything that you can do to prevent it or even to manage that discomfort before you get to that level?
Well, it's important to keep good health. You know, we all hear about diet, exercise, and weight loss, and that helps for joints as well, especially for knees. What arthritis is the thinning of the cartilage that lines the bone. And when present, that cartilage helps for smooth mechanics. But when it wears, it leads to grinding and inflammation. And unfortunately, once arthritis starts, it can't easily be it doesn't reverse itself, and we don't have anything in 2021 that can restore that cartilage. So at that point, the key is really to manage the symptoms.
And doctor, I understand you have an upcoming webinar. What can you tell us about that?
I do. On Monday, August 9th at 12 p.m., I'll be offering a free webinar. I'll be taking questions, and I'll be talking in depth about the aging knee and the different causes, the diagnosis, and the treatments. And please feel free to come, ask questions, and hear further what we have to say.
Excellent. Dr. Covey, thank you so much for joining us.
Thank you very much. Appreciate you having me.